If you've been battling a stubborn cough for weeks, waking up at night gasping for air, feeling that burning sensation in your chest, you're not alone. Over 40 million Americans experience chronic cough every year, and most are treating it completely wrong. What if I told you there's a science-backed, natural remedy using 6 kitchen ingredients that could calm your cough in minutes, without the side effects of commercial syrups loaded with artificial additives? This isn't folk medicine, it's herbal pharmacology meeting modern respiratory science. Stay with me because what you're about to learn could transform your approach to respiratory health forever. Welcome back to Health Morph, where we translate cutting-edge health science into simple, actionable strategies you can use today. I'm here to help you transform your health, one evidence-based habit at a time. Today, we're diving deep into chronic cough, one of the most frustrating and misunderstood respiratory issues affecting millions of Americans. Whether you're dealing with a dry, irritating cough that keeps you up at night or a wet, productive cough with stubborn mucus buildup, this episode will give you a research-backed solution using ingredients you already have at home. We'll break down the 2 main types of cough, explore what's really happening in your respiratory system, examine the anti-inflammatory and antimicrobial properties of traditional herbs validated by modern science, and give you a precise step-by-step remedy that addresses the root cause, not just the symptoms. Let's get into it. Disclaimer. This herbal remedy is for general wellness and educational purposes only. It is not a substitute for professional medical advice. Consult a doctor if your cough persists, worsens, or is accompanied by severe symptoms. Understanding the 2 types of cough. Before we talk solutions, let's talk science. Coughs fall into 2 primary categories, and understanding which one you have is crucial for effective treatment. Dry cough, or non-productive cough. This is characterized by throat irritation, a scratchy sensation, and no mucus production. It's often caused by viral infections, post-nasal drip, allergies, or environmental irritants like smoke or dry air. According to the CDC, dry coughs are among the most common lingering symptoms after respiratory infections, often persisting 3 to 8 weeks. Wet cough, or productive cough. This involves mucus buildup, chest congestion, a heavy feeling in the throat, and sometimes difficulty breathing. It's your body's defense mechanism trying to clear excess phlegm from the airways. Common triggers include bacterial infections, chronic bronchitis, asthma, and seasonal allergies. Both types share common root causes: viral infections, cold exposure, dehydration, and seasonal weather changes, all of which compromise your respiratory system's natural defenses. The science behind 6 powerful ingredients. Let's break down each ingredient and what the research actually says. 1. Black pepper, piperine. Black pepper contains piperine, a bioactive compound with proven anti-inflammatory and antimicrobial properties. Research shows piperine enhances respiratory function by stimulating mucus clearance and reducing bronchial inflammation. It also enhances the bioavailability of other herbal compounds, meaning it helps your body absorb nutrients more effectively. 2. Black salt, kala namak. Unlike refined table salt, black salt contains trace minerals like iron, magnesium, and sulfur compounds. It acts as a natural mucolytic agent, thinning mucus so it's easier to expel. Black salt also soothes throat inflammation and supports digestive health, important because gut-lung axis dysfunction often worsens respiratory symptoms. 3. Carom seeds, or ajwain and thymol. This is the star ingredient. Carom seeds are rich in thymol, a potent antimicrobial and bronchodilator. Studies show thymol relaxes airway muscles, reduces chest congestion, and fights respiratory pathogens. It's been used in Ayurvedic medicine for centuries and is now validated by modern pharmacology for its effectiveness in treating cough and asthma. 4. Green cardamom. Cardamom contains cineol, a compound with anti-inflammatory and antispasmodic properties. It cools inflamed throat tissue, reduces swelling, and is particularly effective for dry, irritating coughs. A 2017 study found cardamom essential oil significantly reduced cough frequency in patients with chronic bronchitis. 5. Gingerol. Ginger is a natural antibiotic and anti-inflammatory powerhouse. Gingerol inhibits pro-inflammatory cytokines and provides relief for sore throat, dry cough, and cold symptoms. The NIH recognizes ginger as one of the most researched herbal remedies for respiratory health. 6. Jaggery, unrefined cane sugar. Jaggery acts as a natural demulcent, coating and soothing irritated throat tissue. It also generates gentle warmth in the body, promoting circulation and helping bind the other ingredients into an effective bioavailable delivery system. Unlike refined sugar, jaggery contains iron, magnesium, and potassium. How this remedy works at the cellular level. When you consume this herbal blend, here's what happens. Minutes 1 to 5, piperine and thymol begin to relax bronchial smooth muscle, reducing spasms and opening airways. Minutes 5 to 15, anti-inflammatory compounds reduce swelling in throat tissue and upper respiratory tract. 15 to 30 minutes, mucolytic agents thin mucus, making it easier to expel through productive coughing. 30 minutes to 2 hours, antimicrobial compounds fight underlying viral or bacterial infections, while antioxidants support immune function. This isn't just symptom suppression, it's multi-pathway respiratory support. Common myths versus facts. Myth: natural remedies are just placebos. Fact: multiple peer-reviewed studies validate the antimicrobial, anti-inflammatory, and bronchodilator effects of these herbs. Myth: cough syrups work faster. Fact: most OTC syrups only mask symptoms. This remedy addresses root causes and often provides faster, longer-lasting relief. Myth: you need antibiotics for every persistent cough. Fact: most coughs are viral. Antibiotics won't help and can harm your gut microbiome, which weakens immune function. How to make the herbal cough remedy. Ingredients: 5 black peppercorns, 1 pinch black salt, 1 teaspoon carom seeds, 1 green cardamom pod, 1-inch piece fresh ginger, 1 marble-sized piece of jaggery. Preparation: crush black pepper, carom seeds, and cardamom in a mortar and pestle. Grate fresh ginger finely. Warm jaggery until soft, not boiling. Mix all ingredients thoroughly. Roll into small marble-sized balls. Store in an airtight container. Usage: chew 1 ball slightly, then suck slowly. Allow the mixture to coat your throat. Use 2 to 3 times daily or as needed. Safety guidelines: avoid if you have severe acid reflux, active mouth ulcers, or diabetes. Reduce jaggery. Pregnancy: avoid due to ginger and carom seeds. Children ages 8 to 14 can use half the dose. Children under 8 should not use this remedy due to potent herbal compounds that may be too strong for developing systems. Remember, this is complementary care. If cough persists beyond 3 weeks or worsens, consult a healthcare provider. 5 FAQ section. Q: how quickly does this remedy work for cough? Most people experience noticeable relief within 1 to 5 minutes as the anti-inflammatory and bronchodilator compounds take effect. Full symptom improvement typically occurs within 24 to 48 hours of regular use. Q: can I use this remedy for both dry and wet cough? Yes, the combination addresses both cough types, soothing throat irritation for dry cough while thinning and clearing mucus for productive cough. Q: is this safe for children? Children ages 8 to 14 can use half the standard dose. Children under 8 should not use this remedy due to potent herbal compounds that may be too strong for developing systems. Q: can I take this with other medications? Generally, yes, but consult your doctor if you're on blood thinners, ginger, diabetes medication, jaggery, or have chronic conditions. Always inform healthcare providers about herbal remedies. Q. How is this different from cough syrup? Unlike synthetic suppressants, this remedy uses natural antimicrobials, anti-inflammatories, and expectorants to address root causes rather than just masking symptoms with fewer side effects. Q. When should I see a doctor for my cough? Seek medical attention if your cough lasts more than 3 weeks, includes blood, causes chest pain, or is accompanied by high fever or difficulty breathing. Your respiratory health is foundational to your energy, immunity, and overall quality of life. Chronic cough isn't just annoying, it's a signal that your body needs support, not suppression. This 6-ingredient remedy represents thousands of years of herbal wisdom, now validated by modern science. It's safe, effective, and empowers you to take control of your health naturally without relying solely on synthetic medications that often come with unwanted side effects. Remember, true health transformation happens when you understand your body and give it what it actually needs. Start small, stay consistent, and listen to what your body is telling you. If you found this valuable, hit that like button, share this with someone who needs it, and subscribe to Health Morph for more evidence-based health strategies. Your transformation starts now. Take care of your health. It's the only body you've got.